You know, it's really quite amazing what we ask our patients to do as physicians. We ask patients in our system to trust us with major surgery. We ask patients to take medications for their illness that may have various serious side effects. Here at the Program for Nutrition and Medicine, we want to add a new dimension to treatment, and that is treating the cause of so many of our chronic illnesses, diet and lifestyle.
Here at the University of Rochester Program for Nutrition and Medicine, we want to help you live your healthiest possible life. To do this, we have consultations. You can come in and see us for an office visit, or you can come to one of our more intensive programs, including our 8-week class and our immersion program. If you want to learn a little bit more about living a healthy lifestyle, as well as our programs, you can come to one of our community outreach events, during which we have lecture and discussion of a nutrition or lifestyle topic, as well as a delicious plant-based meal.
So I started the Lifestyle Intensive program because I have suffered for the last few years of multiple symptoms that really weren't diagnosed with anything except celiac disease and asthma. I decided to do this because I was desperate to make myself feel better. I felt like we were immediately empowered to learn how to take charge for ourselves. It was about looking, is this really wholesome? Is this something I should put into my mouth and help heal my body?
One of our most powerful tools is a healthy diet. We believe that a healthy diet is a plant-based diet. Plant-based diet consists of a rich variety of fruits, vegetables, whole grains, beans, and other legumes, as well as healthy starches such as sweet potatoes. The next question you might have is, what does a plant-based meal look like? And a plant-based meal can be sweet potato enchiladas, it can be mushroom and spinach lasagna, it can be a pineapple stir fry. And at our programs, we want to help you make these meals easy and tasty and familiar to really help you enjoy this food.
Well, I started a plant-based whole foods diet 2 years ago after becoming a patient at Dr. Campbell's. When I started Dr. Campbell's plan, I had weighed in at 242 pounds. Presently I'm down to 187 pounds, which is about a 55-pound drop. My pant size has gone from a 38 waist down to a 34. I no longer need to take the daily statin, daily aspirin, or one of the blood pressure medications I'd been prescribed. Before I started even before I started statins, my cholesterol was up to 230. Now with just the plant-based whole foods diet alone, my cholesterol is 130 to 140. And I'm looking better, I think, and feeling better than I have in the past 15 years.
So for weight loss, I am down about 35 pounds in 3 months. With that, I have found I'm sleeping much better. My asthma, I just returned to my doctor, and she said to me, I'm the healthiest I had been in several years that she has seen. I actually feel healthy for a change.
We recognize that participating in these programs is a big investment for our patients. And really our goal at the Program for Nutrition and Medicine is to make this investment absolutely the most efficient use of your resources as possible. So really at the end of the day, you have the best outcomes that you possibly can, not just in 2 months, 3 months, but for the rest of your life.
And I hope that I won't have to go through the same things my father, my grandfather, my uncles went through, as far as angioplasties, quadruple bypasses, ablation surgery, pacemakers. I believe that this is probably the best chance I have of avoiding all that.
This has been life-changing for me. I feel like I am empowered. This has definitely confirmed I'm healthy and I'm on my way to being even more healthy.